Today's discussion is about neonates and neonatal care, and we've got Dr. Ramya De Silva, the head of the neonatal unit of the Lady Ridgeway Hospital. Doctor, we spoke about, if a baby is born at 28 weeks,
Yes.
then when the baby is 3 months, from that day onwards, you basically take the baby as a full-term baby from that day onwards. When it comes to vaccine, feeding, weaning off, and introducing new foods, how does that matter?
Those won't change with that. Say a baby born at 28 weeks, if they are 2 months old, but if they are healthy enough, they are being given the vaccines at that age.
What's the parent's role? What is the mother or the father's role?
Yeah, usually we encourage these these babies' mothers to come into the unit and to be with the baby.
How important it is for the parents to be with to bond with the child?
Now, you have to imagine that these babies are supposed to be inside the womb till they are about 40 weeks. Even, years ago we thought that these babies won't feel pain or, love and care, all that. But, studies show that, these babies do need a lot of love and care. Imagine the plight of a baby inside the incubator. Every day they are being pricked, their tubes being passed into their throats or into the chest cavity, into the umbilical cord. So
are you telling me when at that age they feel and they sense things?
Yes, they do.
Okay.
So that is why, present day, whenever we do a procedure, right, we always think about this pain. So pain relief in the neonate itself is a, a big aspect. Those days we thought that these babies would just cry and wait, but it's not like that. These unpleasant experiences they undergo when they are in the neonatal unit can, the effects of that will be carried into their adult life as well.
So has research been done on this?
Yes, quite a lot of research had been done.
What are the findings, doctor?
Yeah, most of these babies who had been in a neonatal unit for many weeks or months, most of the time these people have found that they have some kind of difficulties having relationships with their peers or with their parents, or if they are at a school with their friends. So
they can be healthy in every possible aspect, but
the behavior, or they can be aggressive, or they can be very destructive, or they will just be withdrawn and not getting associate with other children, that sort of thing.
So how can one basically, you can have a neonate, you can give the best care and make sure that neonate is basically, healthy in every possible aspect, but also to look at the psychological personality aspect. What does one have to do to make sure that, they don't get into this state? Yeah,
when they are sick, we make sure that they are being given enough sedatives to, relieve their pain. So, by that way we can, prevent them experiencing this very
traumatic. But we think that they're not traumatized, but they are.
Just they are crying only. But we pay quite a lot of attention, and sometimes we go for morphine infusions and all that to make them very comfortable and not to make them too traumatized. And the next thing we do is we encourage parents to come into the unit and to talk to the baby, to touch the baby, to say nice things or listen to their some kind of music or spirit or that sort of thing. So every day, when they hear at least this sort of thing, or when they hear the parent or mother's voice, or they are caressing them and all that, that makes them more I would
so
say.
That bonding is important. I mean, it's been said even with a full-term baby, the mother carrying the baby, feeding the baby, holding the baby close to her bosom is bonding.
Yes.
So that kind of bonding has to take place even though they are in a...
Even though they are inside an incubator, still we allow the mother to wash hands and to touch the baby. They won't be able to take out the baby because the temperature changes and all that can cause problems.
Let's talk about the temperature changes. You're talking about the temperature changes. What do you mean by, say for an example, if a baby is born before 37 weeks, the temperature can drop at...
Yes, the important thing is that these babies don't have fat under their skin and they don't have much energy. Now we maintain our body temperature because we have a thick layer of fat under our skin, and the other thing, if we are cold, we shiver, and the other thing is that we have quite a lot of energy in our liver. There is so much of sugar stores in our body, so if there is an emergency, like, or if we are feeling cold, we can burn all those the energy and make ourselves warm.
So for a preterm baby, they don't have that.
They don't have fat under the skin, so they are their blood vessels are directly under the skin, so there's so much of heat loss, and also they don't have this shivering mechanism, and also their sugar stores are very much low, so they hardly have any energy to burn. So the most important thing our neonatal care is to make these babies warm by covering them with either a flannel or blanket.
What advice would you give, say for an example, if a baby is born at 28 or 30 weeks and the baby goes home at 34 weeks, and still the baby is not full term?
Yes.
In the eyes of medically, it's not a full term baby. So what do parents have to do? What are the things that they need to be cautious of?
The very important thing is that they have to be covered all the time. Especially the head should be covered, because that's the area where there's quite a lot of heat loss taking place, and the baby should not be kept close to a window, because there's so much of air movement and there can be heat loss.
How about bathing?
Yeah, the other important thing is bathing. Babies can be bathed, but it should not take quite a lot of time. It has to be finished as quickly as possible, and after a bath, baby should be quickly
wrapped up and kept warm,
and given a feed. Yeah.
So babies can be bathed.
That they can be bathed, and we always say better to ask the doctor before bathing the baby. And if they are more than 2 kilos, there shouldn't be a problem. But
so does the weight matter?
Matters, yes.
In everything you do.
Yes, it does.
Okay, you won't even release the baby from the hospital till the baby's.
That's right.
So what should the weight be?
There's no fixed weight as such. We consider other factors like how the baby is feeding and how the baby is tolerating feeds. Now before we send them home from the incubator, we put them in a cot, and then gradually the baby is given to the mother, and if there are no major problems, baby can be taken home. But we tell the parents that these babies are very vulnerable to get all kinds of infections, so they should not be taken to places like temples and churches where there are a lot of people. And the other thing is that they should be fed very carefully every 2 hours, like they have to be given a feed. And after that also the mother should observe their respiration and all that.
Another break, and after this break there's more to learn about neonates.